occurs 2 hours after, an hour and a half after, then classically they have small intestinal bacterial overgrowth. Again, because of the purple pill, but that's another option. And then the apple-figured female is adiposity and more inflammation. And that's when we see type 2 diabetes, cardiovascular events, because of the visceral adipose tissue in that gut. Okay, smell test. Pop open your smell test. Or did you already? Did you already do it? All right. So scratch it and smell it if you haven't done so already. We're instituting this in about 2 weeks. Because what we found neurologically, where's my neurologist who was in the room last night? Where are you? Sing out, Louise. No? What we're finding is that if you smelled appropriately before, now you're coming in and you have either lost smell or cannot distinguish the smell, and this is a new finding, then between 5 and 7 years from now, there's a neurological thing that's going to happen to you, whether it's Parkinson's, whether it's early Alzheimer's, but the nose and smelling is a critical tool in seeing what's going on neurologically with you. And also remember how much of your taste is smell, most of it. So people who don't have good taste may not have good smell. 5 to 10% of air reaching the receptors, but if you sniff, 250 cc's. I know there's a joke in there, but I don't have time to go into that. What's interesting, and there was a physician who heard me say this up top, androstenone urinus, 2.2 parts per billion. You know what this is? Males who are marking their territory. That we can smell. That we can smell. So the nose is magnificent like that. And also, the insulin receptors in the olfactory cells that'll be upregulated depending on diet. So that if you don't smell well and your diet is lousy, you don't smell well because your diet is lousy. Again, 70% of diabetics have loss of smell and taste, and actually most of them don't even know it. Most of them don't even know it. And you're looking at vitamin A deficiency. With a vitamin A deficiency, that's going to lead to an increased keratinization or epithelialization of the oral mucosa, oral epithelia, and the nasal epithelia. So you get decreased mucopolysaccharide synthesis, and that leads to reduced cleansing of the receptor area, and then it dries up the epithelium, and then you don't smell so well. The diet deficiencies include the niacin, B2, B6, B5, folic acid. And now what's going to happen when you get that perfect storm of deficiencies is a non-inflammatory lesion of the oral mucosa, especially on the surface of the tongue. So, unfortunately, smell declines with age, affected by your nutritional status, and loss of it associated with, like I said, this prodrome of conditions, classically Parkinson's or Alzheimer's, and then smell and taste disorders that are affecting our dietary habits. How many of us add more salt because it just doesn't taste right? Now, as we get older, if you can avoid the salt but use other cinnamon, other, thank you, I'm 104 years old, it just happened. Other spices, then go to the spices that we know have classic good results for you, like anti-inflammatories, like curcumin, but not salt. If you're going to use salt, I like the Himalayan pink salt. Not only does it have the sodium chloride that is basically cleaner than what you're getting from Morton's because it's been buried under ocean for years and now it's on a mountain in the Himalayas. But it has 80 other minerals in it that table salt does not have that you need. So Himalayan pink salt if you can do that. Classically what we're finding is that you will have obstruction. Please look in the nose. Interesting, if you look in the nose from somebody who in the 80s was a lawyer or some high flyer, you're going to see levels of dimpling or actually a hole in the septum where you can put your finger. Do you know what that's from? Cocaine. So you have that person who's now 68 years old, 72 years old. You say to them, They did a lot of cocaine in the 80s, and they go, how could you know that? Well, I can stick my finger from one side of your face to the other, right in your nose. But you also can pick up a lot of things that are critical. Some intranasal tumors we picked up, a lot of polyps also that we picked up. Drugs that alter smell, this is not in the drug lecture, but calcium blockers, the lipid lowering agents, some antibiotics, codeine, antidepressants. Amitriptyline, old antidepressant that's made a revival coming back for neuropathies. So we have the altered taste. How many have been to a doctor who actually went like this to look for anemia? Really? No hands up? Oh, one hand. We're looking for obstruction. We're looking for the cranial nerves. We do those. And then we're actually looking for those things that turn over within days, whether it's, or a week or two, which is hair, eyes, mouth, skin, nails, peripheral issues, tissues. Here we go. Hair. So you're going to see a flag sign in people who have on-again, off-again. And I mean, it's classic. And you will see those kids, if you're a pediatrician, who have thin, brittle, dry hair. You're going to see, and you know, this is someone who's 52 years old who really has thinning gray hair and discolored, and alopecia. Frequently, biotin, DHA deficiency, essential fatty acid deficiency, zinc deficiency, classic things. We're looking at corkscrew hair, coiled hair from vitamin A and vitamin C deficiency. And like this gentleman's hair was black, I'll go back to him. This gentleman's hair was black, and now it's reddish, and he had no idea. That's called dyschromotrichia. Flag sign, sparse hair, somebody's hair that they brought in Ziploc bags to show me. As opposed to the video I got on my phone from a lady showing her husband's stool that had worms in it. I said, I would have indeed believed you. You know, I open these up and I expect to see my 7-month grandson playing with the dog, and did you see that? Makes you want to go back to no phone. So here you're looking at allergic shyness that we see. This goes along with it. This is called Denny's lines, right here. When you see both of these together, you're looking at gross allergies or multiple food sensitivities. And then if you will learn to evert the upper lid, you will see this as allergic conjunctivitis. Again, we're looking at immune balance, the phytonutrients, eye surrounding tissues. Okay, I put this up here because this is the Arroyo sign, 1924, Dr. Arroyo. After the great flu epidemic of 1918, 20 million people in the world died. Well, that's only 1 billion people total, 20 million. That's equivalent today of 150 million people who died in 1 year from the flu. And those who survived were exhausted. They couldn't get to work. They barely could get out of bed in the morning. They would get up, get dizzy, and fall back down, adrenal fatigue. And he found that when the only sign that was consistent with each and every one of these people was that in a darkened room with his pen light, the reaction he got was this. Either it only got this small, because once you shine, when you go from a darkened room into bright sunshine, or from a darkened cave, like your ancestors did, into bright sunshine, your pupils would shrink, had to shrink, to protect your retina from the damaging effects of sunlight, evolutionary. And when you walk down the road and that saber-toothed tiger came out at you, you went, ooh! At that moment, that oots was your adrenal glands squeezing, and adrenaline came out first, then cortisol. Your pupils would widen a little bit because that usually happened in twilight or sunset when the animals were hunting. You started to sweat, so if something grabbed you, you slipped out because you weren't wearing clothes. You started to clot better because if they clawed you, you didn't bleed to death. The blood shunted from your gut to your butt and your legs so you could run and get away. Now, all of these chemical reactions lasted for about 45 minutes. because in 45 minutes, you're either dead and eaten, or you escaped. Well, that same thing, fight or flight, occurs every single day now to us. In traffic, for me on 95, stress at work, stress at school, stress at home. All that psycho-emotional, psychosocial stress is what gets the adrenal glands tired. Now you don't have enough B-complex vitamins, which they need. You don't have enough vitamin C, which they need. And then you get people who are, no joke, 15 and 16 years old, who come to me to get a note for the principal because they have for years been getting up at 6. Teenagers should not get up at 6. I think they should stay somewhere else actually for a while, but teenagers should not get up at 6. They're in school till 5 or 6, and this poor girl, she had this practice, then that practice, then she had cheerleaders, and she was getting home at 8, eating late. Well, now she had 3 hours of homework. So she wasn't getting to bed till midnight and getting up at 6 every single day. How many hours of sleep do we need? And teenagers need more. So after 2 years of this, she was physically exhausted, and her Arroyo sign got to this and then started to pulsate. Open, close, open, close, open, close. Which meant that the sympathetic nervous system that controls this was not doing its job. And what controlled that? The adrenal gland. You didn't do a blood test, you didn't do a saliva test. All you did was look at somebody's eyes and take a good history. So, and this is what that adrenal test looks like. Classically, you want to be up here in the morning when the first surge is, somewhere around here, and then, so she didn't have well, her get up and go got up and went. She did not have the cortisol to even get up, and then she crashed the rest of the day. This is the micronutrient test that we look at gross deficiencies, insufficiencies. And if you have this in the vitamin B complex portion, then I know that you have adrenal issues because they need your B complex. Critically, they need B5 and B6 with some DHEA and some vitamin C. So I don't even have to do the salivary test. I don't have to do the physical exam of the Arroyo sign for the pupils. If I get a micronutrient test back that the B complex is all low and somehow I miss to do the exam, then I will do the exam and everything will point to the same thing. Saliva, blood, and physical exam, which we weren't taught. Okay, many of us have seen this, Arcus senilis, xanthomas, early Arcus. This is a dyslipidemia transport system error. That's all I will say on that. It means you better look at what's going on with their cholesterol, either familial-wise, our mouth exam. So, 8 steps here, which I have to catch up on this slide. The jaw movement. If you open your jaw really wide and take 3 fingers, can you fit 3 fingers in there? If you can't fit 3 fingers in there, you have an issue with your temporomandibular joint. You see how funny you look going doing that. Then we're looking at the lips, palate, tongue, gums, the mucosa side teeth. So you've seen this. I mean, I see a lot more of it. But we see things with zinc and vitamin A, C deficiency. We're looking at the aphthous ulcers, if you've ever had them. This is critical for the lysine-arginine balance. If you're eating peanuts, if you're eating chocolate, if you're eating Baby Ruth candy bars, that's the worst, chocolate and peanuts. Then you need to, and it's high in arginine. Arginine will help the herpes virus replicate. So if you're getting it, don't eat chocolate and peanuts. Also, just don't go into the bright sun quickly because that can also trigger it. What you do want to do is take lysine. Now, the exact dose, I think, is 1,232 milligrams a day, but if you can do 1,500 a day because it comes as 500 milligram capsules, you will prevent the replication of the herpes virus. We also use vitamin C, but if it breaks, you have to use acyclovir or famciclovir. And then the prelate, angular cheilitis, for B6, B12, folate, and other minerals. And then we have our tongues. What you see with the tongue, and we'll go right to them from here, is that the B vitamins are critical for having a normal tongue. This is a great example of what we call scalloping. You see this? That means your tongue is too big for your mouth. Sorry. Now, if you have severe hypothyroidism and you have something called myxedema, then you will talk like this. I have a few people like that. But if you don't have that, and you don't talk like this, and you have abnormally swollen tongue because the teeth are imprinting on the sides of your tongue, that's where you're getting the scalloping. Classically, multiple food sensitivities, not allergies. Food sensitivity testing, food intolerance testing is not an allergy test. It's not an antibody antigen reaction. It's not IgG, it's not IgE, and even IgG is not really accurate for food sensitivities. IgG is that immunoglobulin that comes out 2 to 6 weeks after you have something in your body. You shouldn't, but it's more protective. But we use cell-mediated testing for food sensitivities. So now we have a new taste called umami. I believe it stands for your mother. No, umami is delicious. Let me see. Umami, yes, here it is. Umami's Japanese word means, savory. And it's elicited by L-glutamate, which is basically a neurotoxin. Think monosodium glutamate, and why you no longer eat that. This was discovered at the end of World War II in Okinawa. I think it was Okinawa. When the island was taken by the Marines, they found this cache of meals ready to eat for the Japanese army. So they opened it up and they started eating the Japanese meals to see what they were eating. And these guys said, this is savory. No, they didn't say that. This is delicious. Everything was delicious because of the MSG that the Japanese had put into the MREs. So it went back to the States, it got studied, it said, oh, it makes food delicious, and then it went into our food supply. Umami, MSG, which is accent, which you don't want to use for the Alzheimer effect. Yes, I know, okay. So what do you look for? Color coding, fissuring, scalloping, piercing. Oh, I hope we have that. Tongue coating. We now use a scoring of 0, 1, and 2. 1 is thin tongue coating, 2 is thick tongue coating. So what they did was they decided to see if there was any issue with bacteria and candida. And what they found, let's see, is that the next one? No, it's not. Oh, that's my piercing. Well, not my piercing. So we, by we I mean they scraped off the coating on the tongues that we're looking at. And what they found was the thicker the coating, the more anaerobic bacteria that were on it to become bacteremia, to make you sick. But the thicker the coating had no effect on how many species of candida there were. So it was just bacteria, but I mean, that's enough. How many stick tongues out to each other to look at this? Because a lot of these are easily fixable. And it'll make you want to have your loved one use their tongue and down your throat. All right, somebody's teenager. You have teenagers who have this? Okay, how about this poor guy, his son? Actually, I think that was from those eggplant skewers we had the other night. So, we won't make a socially conscious discussion about this, but we're using stainless steel because everyone thinks stainless steel is healthier, as if sticking things through your tongue is healthy. What we found, though, is that there was more bacteria in stainless steel. Of the 80 bacterial species that they found on these, 67 of them were on the stainless steel. But if you used the cheaper polypropylene, you didn't have it. So tell your children and grandchildren if they're going to pierce their face and their body to use polypropylene and not stainless steel. Geographic tongue. When you see this, that is a patient that will tend toward multiple allergies. If it's painful and it hurts, then you're looking at gross deficiencies in B vitamins as well as with iron. And this is associated with inflammation throughout the body. One of my favorites, black hairy tongue. This linear midline fissure is suggestive of something called an upregulated gut immunity issue. And you'll see this 3 times more frequently if somebody has psoriasis, because psoriasis begins in the gut also, as does eczema and a host of other autoimmune diseases. So when I look at this, I know that this person will either already written down that they have gut issues, or on questioning they will talk about their gut issues. And it's just shown from the tongue. And then we have biotin riboflavin deficiency with the burning tongue and then the buried tongue. And then we have all my other tongues here. The candida from antibiotics causing dysbiosis because we killed the good bacteria in the gut with the antibiotics. I'll say it again, I think it's Tuesday or Thursday. If you're taking an antibiotic because somebody knows that you have a bacterial infection, not if it's a viral infection. You're not the type that goes to a doctor with a cold and says, give me a Z-Pak, right? Right? Because antibiotics don't work on viruses. But what they will do is kill the good microbiome in your gut. But think about this, they kill all those other bacteria in the rest of your body that you also need. There's more of them than there are of us. There's more bacterial DNA in the human body than there is human DNA. And I'll say it again, we are meat buses for them. We carry them around. So we're looking at leukoplakia, things that may become cancers in the future, something called medium rhomboid glossitis with the candidiasis, allergy, intolerance, taste bud atrophy. I mean, this is the tongue of that guy who looked like something from Halloween. You have complete atrophy of the taste buds because of the niacin deficiency. And then this is from Michael Stone, as are some of these other slides. Great diagnostician, learned a lot from him. He's also with the Institute of Functional Medicine. And then the gums and gingiva. Any dentists in the office? In the office? Good. Thank you for doing what you do. And don't look so down in the mouth, because you do a great job in what you do. And I send my patients to dentists who send them back to me. Well, after they fix them, but we do it together. They get their mercury amalgams out, and then we get rid of the mercury. Now we're looking at your neck. Do we look at our neck? Straight line down, fine. Now we're looking at the bowing outward. By we I mean me, I will jump up on the back of the table and stick my hands around your throat and palpate your thyroid as you swallow. That's what you're supposed to do. If you're not doing that as a physician, or your doctor doesn't do it, they need to do that. Nutritional considerations: protein, iodine, zinc, selenium, intestinal permeability, celiac history. What we're finding is that if you have something like a Hashimoto's thyroiditis, one autoimmune disease begets another autoimmune disease. It can be familial, where mom had something, dad had something, great-grandmother, Aunt Tilly, and you're having issues. It's also, there's a genetic predisposition for that. And then goitrogen intake. You can't really eat enough broccoli to make that happen, okay? So when people say, oh, you're a vegan, well, you have to watch out for your thyroid. Well, great. I have not seen any one of you eat 12 servings of broccoli at one sitting. And is Jessica Porter here? She said we would have changes by Wednesday. Okay, I know where every toilet in this ship is, so we're already having changes. The functional considerations of issues with your thyroid. I know I have to move faster. One of my favorites, because we all have it, and most people will come in exposing their skin. I don't know if you can appreciate this. All right, this is hyperkeratosis pilaris. This classically is going to be essential fatty acid or vitamin A deficiency. I will ask people their fish intake. If they eat no fish and they don't take the other essential fatty acids, you can do it vegan also from algae. Or they don't like walnuts, or they won't eat avocados. They will have this. One of my favorites, acanthosis nigricans from hyperinsulinemia. You can actually, without doing the blood work, if you see this, you will find that somebody has hyperinsulinemia. It's that smooth, velvet-like, hyperkeratotic plaques. That sounds like something on a brochure, doesn't it? In the intertriginous areas, whether it's the back of the neck where you see it mostly, axillary groin. So it gets better when the insulin level goes down. What happens is that there are binding sites for insulin on the keratinocytes, insulin-like insulin growth factor, and they hyperplaze. They get more. They get bigger, and they get, well, obviously velvety and smooth. And you can take that morbidly obese patient who does not have frank diabetes yet, but has a hyperinsulinemia because they have the acanthosis nigricans. And when they eat better and their insulin level goes down, this goes away. And this is a visual of how they're doing diet-wise. If you're not doing fasting insulins and 1 and 2 hour insulins with the glucose, you should be doing that, because you can have not quite frank type 2 diabetes, but still have hyperinsulinemia and insulin resistance. And then one day it passes the line, and suddenly, overnight, you've become diabetic. Not the 4 years it took to get there. And then we're looking at lack of zinc, vitamin A, biotin for seborrhea, eczematous rashes, xerosis, again, vitamin A, EFA, C, zinc. There's some more hyperkeratosis pilaris. Some of them are very intense, and some of them it's very, very subtle. So I'll know you were here today if you're walking around the ship and you're rubbing other people's arms just like this. I know I do that, which is scary. Something we don't see that often anymore, which is early signs of scurvy, swan neck hairs on the skin, the petechiae, vitamin C, deficiency, easy bruising of that. And again, general, that's where they got the word limeys, because the British Navy had to put lime on ships because the guys were getting scurvy. Nails. They grow 0.1 millimeter a day, or 0.5 to 1.2 milligrams a week. Somebody cut people's nails and weighed them. Isn't that interesting? But you can press your nails and see if they're weak. If they bend in the middle and you have long enough nails, you're going to have a protein deficiency, maybe from low hydrochloric acid in your stomach where you're not breaking the protein out. But we have better ones. I just like this because that's our blood flow to our hand. Outdone only by the nerves and thermoreceptors on the back of your hand. That's why your mother went like this. So you're looking at the shape, color and pattern, texture and strength, growth pattern, and surrounding tissue. I mean, we've all seen people who part of their diet is their cuticles. And they have none, and it's all right down here. The standard ones we know of, the Cholinicia with iron, copper, zinc, protein deficiency. Better ones with, let's see if we can see this. There's a hint of a white spot here. This is Leukonychia. This is also Leukonychia, but this is Leukonychia punctata, and this is Leukonychia striae, which I see every single day. This is more for zinc, because air gets into the nail, and this is classically selenium deficiency. And you will see people, now that you know, come Thanksgiving, you need to look at everyone's nails in your family. What will give this back to you? 2 or 3 Brazil nuts a day will give you selenium. Clubbing, we know inflammatory and sprue. Bose lines, which are right across the line, you're going to see it indented for hypoglycemia or zinc deficiency. This is a big one we see. This is gross malnutrition. In America, people eating, they come in obese and they're malnourished. And then the iron, protein, zinc, copper deficiency of Cholinicia. My favorite. This is from Nosferatu, the Dracula movie. Now, this is a homeless person who has this. So Count your blessings. One of my favorites, we started doing this last year. Those of you who are my patients in here, if you didn't have it done, if you're in the area, come in and I'll do it for you. We take the 128 hertz hammer and we tap it and we put it on your big toe. And you should feel the vibration. And depending when you lose the vibration, will let me know that you have decreased vibratory sense. And classically, that will go with either heavy metals or B vitamin deficiency. So if I have that answer, and I see that your tongue, there's an issue, or you have a methyl tetrahydrofolate issue, or you've got what we call stippling under the tongue, which I didn't have a photo of, then I'll know where to look for. And you know, I said the answer was in the last slide. That's the best doctors: sunshine, water, rest, air, exercise, and diet. So you're on the right track because I'm eating what you're eating primarily. But we'll talk about gluten in one of the lectures, because even if you do not have celiac disease or gluten sensitivity, you have to remember that 2 slices of whole wheat bread has a higher glycemic index, sugar index, than a Mars bar. So if you think you need to lose some weight and you're eating your veggies and you're not, you want to get off the gluten at that point. But thank you for coming. I hope you got a few things to take away, and we'll see you during the cruise. All right? Thank you. And they have somebody else, so I'll answer questions up here if you have